Dallas Ducar is one of the nation's leading voices in transgender healthcare. At a moment when access, policies, and patient care of transgender people are all under legal threats from the Trump administration. As Executive Vice President of Donor Engagement and External Relations for Fenway Health, and as a nurse practitioner, Dallas has been on the forefront of building inclusive, community-centered models of care for transgender and gender-diverse people. In this conversation, we explore the rapidly shifting landscape of transgender health in America today, where medical expertise increasingly collides with political debate and partisanship. Dallas offers a clear-eyed view of what's happening on the ground, how patients and families are navigating new barriers, how providers are responding under pressure, and what's at stake if access to transgender care in our country continues to erode. At its core, this episode of Profiles in LGBTQ Courage is all about courage. The courage of patients seeking care, clinicians standing by their ethics, and leaders working to build a more equitable healthcare system in uncertain times. Dallas brings both urgency and hope to this conversation, offering insights into what the future of transgender healthcare could and should look like in America today. Dallas Ducar, welcome to Profiles in LGBTQ Courage. It's a pleasure to have you here today.
Hey, Rick. Thank you so much for having me today. It's a true pleasure.
Dallas, we're here today to talk about the state of affairs in this country around gender-affirming care and the treatment of transgender people in general. And I think it's fair to say that there's a seismic shift going on right now. We have an administration that, in my view, has effectively declared war on the transgender community. So I'd like to start by asking you to kind of sketch out for us what you see happening globally right now, and what are the various trends, dynamics you're seeing take place now around this issue?
Yeah, of course. Well, thank you so much for having me on this really important issue, Rick. You know, I would first and foremost just say that trans people are just like anyone else, right? And unfortunately, what we've seen since at least around 2016 is really a heightening of disinformation and discrimination against trans lives. And this has largely been based out of fear and also a desire to drum up votes, specifically for the Republican Party and conservative elements of this country. We see in 2016 bathroom bans coming out of North Carolina first, and specific language that talks about biological sex in statute. And that language was not used in statute prior to that time, right? Before then, gender and sex were used interchangeably. And since then, we've seen copy and paste legislation that's really been authored across many, many states where trans people where people have attempted to deny trans people access to any public accommodations, to locker rooms, to being able to participate in sports, to being able to receive health care. And this has really been a way to say that everyone else except trans people are able to get access to the same equal rights that our Constitution guarantees, right? And unfortunately, we've seen this copy and paste legislation really spread like wildfire, and especially be pervasive in really restricting trans youth from being able to receive life-saving health care. And that has really been the end goal, at least for now, of so many different groups that are really trying to sow disinformation and really trying to, at the end of the day, retain power. And that's really what this is about, is trying to retain political power. And there's a longer game here, which is not just focusing on trans youth, but trans adults. I don't want to be someone who is a scaremonger here, but there's very clear evidence that there's a longer game to really control who gets access to healthcare, and who does not.
You know, you spoke earlier about disinformation, and I think it's important for our listeners to let them know, we're dealing with disinformation and misinformation. So misinformation, of course, is inaccurate information that people project and share unwittingly. They don't intend it to be erroneous, though it is. Disinformation is a proactive effort to really dissuade or lead people astray. So what do you see most prominent today? Is it misinformation and disinformation, or is it both?
I would say that it's somewhat difficult to tell at times because you have to really understand the intent of who's trying to spread that information. But we do see tons of disinformation that political campaigns in particular have invested millions of dollars in to try to ensure that there is robust disinformation around either maybe what a political candidate may believe and prioritize to what is actually happening in terms of healthcare. And let me be clear, there are no trans youth who I am aware of who have received gender-affirming surgeries. That is extraordinarily rare. Where we see surgeries really occur in youth are largely in non-transgender populations who are receiving cosmetic surgeries due to our own society. What we really see in a robust amount of gender-affirming care is first just starting with using the right name and the right pronouns and referring to someone with respect and creating a safe environment where someone can be free to be able to be themselves. And then oftentimes following very clear criteria, standards of care that don't include, for youth, surgical services. Unfortunately, we have seen political talking heads try to contort that, disinform, and say that this is not life-saving care, which is incorrect, and focus really on the medical aspects when there's so much more to this than just the medicalization of an individual.
And can you talk about some of the disinformation and the misconceptions around what gender-affirming care is really all about and what it is not about?
Yeah. So one of the points that is really, unfortunately, out there in the ethos is that gender-affirming care is too readily available and that providers are essentially handing out hormones or puberty blockers without talking to parents and getting parents' own buy-in on this and consent. And that's just not true. This process of gender-affirming care, especially for youth, involves really, really robust protocols, frameworks, bringing in mental health professionals, bringing in adults, guardians or parents, and making sure everyone is on the same page. And really, it's comprehensive care. That's what this is. It's really involving a multidisciplinary framework too, and making sure that the process is somewhat slowed down. There's also so much disinformation around this notion that there is a rising amount of trans youth and that is due to some type of social belief.
The social contagion idea.
Yes. And, that's also really been debunked again and again. It's very natural that if you have anyone who feels safer in being able to be themselves, that they would naturally be able to speak to that, right? But that's just a byproduct of society becoming more accepting. And we can see the same phenomena with, historically, folks who have been left-handed. And we saw a reduction in left-handed people up to 1950 or 60 or so. And then when we stopped seeing left-handedness being punished in schools, there were more left-handed people, right? And so when a society can be more welcoming to an individual or to a group of people, then people are more free to express themselves. And that's just a natural, real byproduct of democracy and a product of actually creating a welcoming and affirming atmosphere.
Dallas, in your experience, what happens to healthcare systems when policy is driven by politics?
We get terrible outcomes. That's what happens. At the end of the day, we should be really working towards a value-based care system, and that is getting the right care at the right time for the right patient, regardless of what type of care it is. And there are so many times I have seen, either as an EMT or as a nurse practitioner, my own profession, people really delay care and end up really using the emergency room as their primary care provider or mental health provider. And that's a waste of resources, Rick. At the end of the day, we need to be investing in preventive care, and we need to be investing in getting patients the care that they need up front. And so that means having patients get the care they need in primary care and in mental health care spaces early on, right? So that whatever they're struggling with doesn't compound over time. And unfortunately, if you experience discrimination, whoever you are, in your primary care or mental health care office, you're probably not going to go back, right? And so then you might wait, but the problem will only get worse over time if you don't get the right treatment that you need. And then maybe you're seeking emergent care or urgent care, somewhere in between there, but there's an increased cost to the system, there's an increased cost to the body, and that is not what we should be striving for as a healthcare system. So instead of playing politics with healthcare, we should be seeking to get people healthcare that's cheaper, more affordable, at the right time, and the care that they need based on what they say they need, guided by standards of care.
I want our listeners to know that in addition to working at the public policy level with Fenway Health, you're also a nurse practitioner. So you speak from the point of view of field experience, working with patients and the like. And to that point, I want to ask you about puberty blockers, because they tend to be, that becomes a very sore political point with a lot of people. It's my understanding, and please correct me if I'm wrong or clarify what I'm asking you, is that there can be a reason for someone whose gender identity is emerging, for them to have puberty blockers so that their sense of their gender identity can consolidate and come together. First of all, is that true? And what would you add to that, or how would you expand on that?
Yeah, so puberty blockers or GnRH analogs are really used. Initially, they were used to treat precocious puberty, right? And they've been used in non-transgender populations or cisgender populations for many, many years without any concern at all. And then really it was more recently that we started to be able to see puberty blockers being used in younger trans populations. And that's really a way to slow down the clock, if you will, on puberty, to buy some more time so that the child does not actually have to experience the robust gender dysphoria as a clinical diagnosis, and also increase risk to their own life during that time, because we know that the suicide attempt rate in trans youth populations who do not get affirming care is so high. And so instead, buy some more time, get the parents or guardians on board, also really bring in the integrated treatment team and be able to talk a bit more about what's going on and be able to understand the experience of that patient a bit more. And wouldn't any parent want to better understand their child? At the end of the day, you're not going to stop someone from being able to be trans. That's discredited. There's no science behind that. The best evidence is to value who is right in front of you right there.
Yes. And I've heard this phrase a lot, and I'm sure it's familiar to you, that one thing that parents and the loved ones of a transgender person or someone who is thinking they might be trans, what is it? If they are consistent, insistent, and persistent in talking about this, what does that indicate a parent should do, a loving parent should do, to try and lean into that and understand it and be supportive of that person's emerging identity?
Yeah. Well, I would say that from my experience in talking to a lot of non-transgender people, they did not grow up consistently in their childhood wishing or praying that they were the other gender in some way or some other gender. And for a trans person, that's a bewildering experience, because so many trans people will consistently feel almost as if they have been assigned in the wrong body in some way, right? And when younger, that can emerge through many different difficulties for young folks with anxiety, depression, self-harm, many other psychological difficulties. And so, for a parent or a guardian who's seeing and hearing their young loved one talk about this persistence of feeling in the wrong gender or the wrong body, whatever it may look like, it's starting to talk about that. That's really the best thing you can do, is start to open up the door and just say, hey, I see you, I hear you, and let's begin to talk about this. And it doesn't necessarily mean you have to jump to go seeing a mental health professional. I think so many trans people in general and trans youth can be fearful of medical professionals or healthcare professionals because they may feel that there's something wrong with them. So starting with that trusted relationship and starting with a family that is accepting without the government interfering in whatever the family says, right? But starting with that family is really the first place to start. And then moving into, let's maybe go talk to someone who is trained in really talking about this too.
So just for me to get clarified here, so the consistent, persistent, insistent thing may or may not be there. Is that what I hear you saying?
I would say that for every trans patient who I've treated who's been younger, and for what I've seen from literature, it is there. The consistent, persistent, insistent is there, but some trans youth may not feel comfortable expressing themselves in some way. And so you might not see it if you're a parent, right? You might not hear them disclose it. And so that's why the trusting relationship between a parent and a child is so important, because more often than not, that child will then talk about a long history of this consistency.
Dallas, what are you seeing right now in terms of patients traveling across state lines for care? Is there data that are being gathered around this issue by Fenway Health and other organizations?
Yeah, I will say that I am unaware of one repository where this data exists. And, unfortunately, there's such a chilling effect on healthcare providers in general and in some of this data collection and reporting who has left a state where they did not, where their healthcare was not permissible under law, that there's a lot of fear there, right? So there's a unwillingness sometimes to report. There's a lot of anecdotes out there, which people can find in many different stories online or in different news outlets too. I know that organizations or outlets like the Globe have really covered this well recently, or NPR. But also what I can tell you from my own experience when I was at Trans Health as the founding CEO there, in 2019, the landscape was so different than when I was there around 2024, for example. And in that time frame, we saw a robust amount of patients coming in from other states trying to access care. That was one reason why the SHIELD law was also created too, to be able to help extend care constitutionally across state lines. And that is also why we've seen updates to the SHIELD law too, to be able to really expand access. I will also say from talking to many other providers in the community, the providers have continued to see just more and more numbers of patients who are able to afford it come to places like Massachusetts. Unfortunately, there are a lot of others who live in poverty and are unable to afford a move. And there are nonprofits out there that are there to help them get the care.
What's your advice right now in this political climate? What would be your advice to the parents, the loving parents of a child who appears to be trans or who is exploring that possibility? Where do they turn for resources? And do they talk to their GP? Do they seek guidance online? Can you talk a little bit about that? What can they do that's meaningful and will have impact?
Yeah, I would say, PFLAG is actually a great resource, and going to other support groups too, especially places where parents can talk to other parents, because it's really scary sometimes. I will say from my own experience, when I came out, my mother was really afraid for my own safety in a lot of ways. And that was hard for me to understand at the beginning, but it took some time, right? And so I can really empathize now with other parents who might feel fearful given this climate. And so talking to parents can be a great space who've been through this before. It may feel like a crisis at that moment. It's important to remember it's not a crisis. There's time. You can be starting those conversations with your kiddo. And then there are many different mental health resources that are out there that can specialize in providing mental health therapy. It's important to note that in the way that perhaps hormones and puberty blockers may be restricted in many states, talking about this is not, right? Talking to a licensed mental health professional. And so being able to talk to someone is really, really important. Mental health professionals are really the front line here right now. And you can get a lot of good resources at places like Fenway, at many other LGBTQ health centers too, places like Trans Health as well. And many times too, getting references from other parents who were able to go through a similar process is really, really important. So I'd say, don't be afraid to talk about it. Don't be afraid to engage your child. And really, it's important to not broadcast any stigma and not get the fear you may feel be projected on your child in any way, because they're already dealing with a lot.
Do you have a theory or a perspective on why the trans issue is such a hot button issue and why politicians have been able to make such hay with it?
Yeah. Well, I think it goes back to COVID. I think there's a through line to around COVID. There's been a lot of medical mistrust in society for a very long time, especially by populations who've been minoritized. But increasingly during COVID, we saw more people distrust public health, distrust institutions. Pundits took the place of public health professionals too. And there's been just more distrust in healthcare, right? Now, nurses are still the number one trusted profession. They have been for many, many years. The only year that I'm aware of that they were not was during 2001 when it was firefighters, during 9/11. Outside of that, I think nurses especially was the most populous health profession, have a duty to really continue to build trust in the healthcare system. And we all have a duty to build trust in institutions right now. Unfortunately, though, because there was so much distrust around the vaccine and so much distrust in institutions around COVID, I think we've seen that distrust continue, disinformation continue. And we've seen that as really the Republican Party began to invest a ton of money in anti-trans talking points in lead up to the last Trump 2.0 election. I will say, though, recent polling shows, especially out of New Jersey and Virginia, that tactic has not continued to be effective. And I think we will find that the more that politicians try to focus on the identity politics here and instead do not focus on bread and butter issues and kitchen table issues, the more voters aren't going to buy it. And I think we're really seeing that right now, and we'll continue to see that, Rick. But unfortunately, it's because so many people don't know that they've met a trans person, because trans people make up so much of a small proportion of the United States population, they're easy to attack because you can turn them into a boogie person and say whatever you want. And many people don't even know that they've met a trans person, which is why telling stories, narratives, and trans people being out when they are able to is really important.
This administration has gone after trans healthcare for trans youth in a big way. Are you at all hopeful that the courts are going to slow down some of these efforts by this administration to really erode this care?
Well, I'm grateful you asked that question. I also serve as the vice chair of GLAD Law, which is a legal impact organization out of Boston. And I have seen firsthand that organizations like GLAD Law and others have been really, really effective in slowing down the attacks. We've seen a lot of success in the courts, even if it doesn't seem like that. Even dating back to the first P-flag injunction, we saw really effective injunctions that stopped the executive orders that were put out day one, when a lot of us learned what an executive order was and that it's not necessarily
We all learned when this administration came in.
Exactly. It's been a big civics lesson for sure. And since then, we've seen some really scary stuff out there. We've seen HHS in this current administration put out two separate rules that attempt to either prohibit the use of federal funds for pediatric gender-affirming care or to prevent hospitals from enrolling in Medicare and Medicaid if they also provide this care, which could be devastating to their bottom line. And we've also seen the Secretary of Health and Human Services put out a declaration that would basically say that HHS has the declaratory power to be able to say what and what is not medicine. Now, we've seen some great success there. We've seen the courts be very successful against the declaration, and specifically the judge there saying that,
I have that article right here.
Yeah.
It's the one rescinding the federal funding. A federal judge vacates Kennedy's threat to rescind federal funding to any hospital that provides gender-affirming care to minors. It's a fast-moving topic. Is that still the case today, that stay holds?
That holds. Yep, that holds. The judge was very clear about it, and it was a great ruling for medicine, for healthcare, right? That politicians shouldn't be deciding what is and what is not healthcare. And the government should stay out of decisions between parents and kids.
It's just, we talked about this a little bit the other day when we were getting ready for this interview. Politically, organizationally, what can trans people do to kind of build a coalition of support around them, to make this not just about them at this particular moment, but about other people? What are your thoughts and recommendations there?
Yeah. Well, I'm brought back historically to some of the civil rights battles, actually out of, I think it was the UK, where LGBTQ individuals and minors actually banded together because they were both groups that were being harmed by the government at that time. And I think it's really important in minors, I meant people who actually work in the mines. And I think it's really important for any group that may not have the same political power as a majority to create coalitions. That's what's really important in a democracy. And so it's really working to be able to understand the shared values that you have with others. And I see a lot of shared values in what we're talking about today. The freedom to be, the liberty to be able to make one's healthcare choices, one's own pursuit of happiness, right? Those are all things that we're talking about right now. And those are all things that many other Americans, I would say, agree with, and many other people in general. There's a concept when trying to communicate this, where there's a grouping of people called the movable middle, essentially. And that's really where you want the message to land, right? I'm sure that a lot of people listening to this podcast right now are probably not in the movable middle. They're probably, I really believe in this. I agree. This is great. There's also another grouping of people who may never change their mind, right? And that's what they believe. But there's a large group of people that might be subject to some disinformation. They might have some misinformation. They align with the values, and maybe they just don't fully understand. And that is the group I am really interested in talking to. That is the group that I really believe we need to build coalitions with, too, because that is how, at the end of the day, we are able to reclaim this issue and reclaim the voting box.
My last guest on the show was Alejandro Marcel, who told me a very moving and rather graphic and compelling story about being a trans person navigating the healthcare system, in his case as an elder. And he spoke very powerfully sitting in that chair about the fact that in so many cases, medical professionals, doctors, I guess, and others don't know what to do. They don't know how to treat or interact with trans people. And I'm wondering what your counsel is to your fellow healthcare professionals and colleagues, doctors and others in that regard.
You need to go back to school. That's what I would say to them. I mean, there's nothing that is remarkably different about a trans patient and a non-trans patient. And if you're focused so much on someone's identity, you're providing bad care. And I would argue you could be legally liable for negligence in some way, right? And so at the end of the day, if you are concerned at all about providing the best care to your patients, then that means making sure that you really, first and foremost, put their humanity first, right? And when we recognize that the root of the word patient is pati, which means to suffer, right? And, similar root to compassion, which is to be with suffering. If we recognize as providers, as healthcare providers, that everyone who comes in through that door is suffering in some way and our job is to do no harm and to alleviate suffering, then I think we can all be pretty unified in that ask. There might be, little bits and pieces that you might need to read up on what it means to be trans, but that's your job as a clinical professional who has gone to school and was educated to do this work. It should be your job to educate yourself. The patient should not be educating you.
I want to go back to this issue of gender-affirming care because I think we know that science continues to evolve in its insight and knowledge. How do you respond to critics when they say, well, the science around this isn't settled and we need more research, we shouldn't act too rashly? How do you respond when you hear that kind of thing?
Well, I would say that what we're seeing in this country is the opposite of that. We are not seeing investment in research around gender-affirming care. And I would love to see more research as well. I have no issue with putting more money in research. Unfortunately, that's not where we are. Additionally, I think what we know from the research thus far is there's just not enough access to care. And really, at the end of the day, what we're talking about is healthcare that doesn't discriminate against someone, right? This isn't rocket science. And so I would say that we need more access to care that's not going to discriminate against individuals so that people can get better care where they are when they need it at the right time, place for the right patient, to then reduce the fiscal burden on our healthcare economy, and also to ensure that patients are able to receive compassionate care where they are. And so, I have seen, as someone who is clinically trained and has written many articles myself in peer-reviewed journals, that the science is settled. What is not there, though, is more investment in research and more investment in access to care, and that's what I would like to see.
A few weeks ago, you gave a talk here on the Cape at First Parish Brewster Church, and you talked about the consequences of not providing trans care. And could you talk a little bit, Dallas, about what we risk here in terms of the already risky factors associated with the trans population? Can you talk a little bit about the downside of us not leaning into this and doing the right thing?
I mean, I think what's borne out in the literature is that people will die. That's very clear. There's a staggering suicide attempt rate, around 40% or so by some studies, that is just... It's just a shame it should not be possible in this country. And so the consequences of not providing care are that people can die. Outside of that, there's really robust consequences of people not being able to get the right care when they need it, and then costs also going up too for a healthcare system. And there's also, I think, a larger narrative here in that if we say that some populations can't get access to healthcare because of who they are, what stops that argument from continuing? What about adults? What about folks who are at risk or live with, HIV or AIDS? What about people who are from different races or ethnicities, right? It's a slippery slope. And so, there's a reason why we have non-discrimination protections baked into the law, and it's really important to be able to ensure that those protections are upheld, because at the end of the day, we as providers should be working to get access to care for anyone who appropriately needs it.
What would be your advice today to a young person who's maybe questioning their gender identity? They might have a supportive family system around them. They might not. What's your advice to them about how to take care of themselves in this fraught political time?
Well, I would remind them that the internet is not always real life. Social media is not real life. It's really hard to remember sometimes, but it's really important to disconnect at times from social media. For many, though, that may be their only way to connect with others, too. So I'm not suggesting by any means that you shouldn't go on it, but there can be really hurtful messages out there, too. And it's important to limit the influence of those messages. It's also really important to limit how much you're around hurtful messages in general, right? There's a lot of really hurtful stuff out there. And youth especially do not deserve to hear those messages because they're not they're not grounded in reality. They're grounded in fear, right? And we shouldn't be playing politics with young people's lives. And so I would just say, remember that you are loved. Remember that there are people out there who care for you, that you yourself will look back later in life and be able to know that you survived and you were better for it. I think all the time about what I would tell my own self as a young kiddo, and especially during those times that it felt hopeless. It's so important to remember that there is hope out there, and there are people who genuinely love you for who you are and who you will become.
Just another couple of questions. I am curious, if you could influence just one policy, one system change, one cultural shift right now, what would it be? What could help shift this conversation and this direction of our healthcare policy around this issue?
Wow. If we're talking specifically around trans access to care, then I would, if we're talking policy, I would guarantee healthcare access for all LGBTQ folks across this country and write it into statute. I think that there needs to be a very clear Bill of Rights for LGBTQ folks and specifically trans folks. And, shout out to Senator Ed Markey from Massachusetts, who's championed that for many years. When we talk about the cultural shift, I think it's so important that we have to reach that movable middle. We have to change hearts and minds. That's what's really going to make legislation like that really viable at the end of the day. And if there was one thing I perhaps could really wish for, it would be that everyone in this country had a trans friend.
They may not know it.
Exactly. Yes. And if everyone just knew someone and was friends with them or family with them, I think we'd be in a much different place in this country.
Dallas, is there anything I haven't asked you directly about today, but that has bubbled up as we've been talking that you think is important for our listeners to hear you talk about?
Sure. Yeah. I think oftentimes when we talk about gender-affirming healthcare, that alone can seem maybe somewhat nebulous, right? And people say, what is that? And I think it's really important at the end of the day to remember that this affirming care is person-centered care. It is putting that person in the driver's seat, parents and guardians included too, and following that individual, that patient's values, right? And doing so in a way that's trauma-informed. And who doesn't want that type of care at the end of the day? I would argue that affirming care is just good health care. And that's what the standard that we should all be striving to. I would also say that for anyone who's listening to this, remember that there's also a lot of politicians that are doing a lot of really good work. I have the privilege to be able to work with Senator Julian Cyr from the Cape and Islands, Representative Sam Montano, Representative Marjorie Decker, and many others in the Massachusetts State House. And we were able to help work to make a affirming trust fund a reality. And that's up before the legislature now to essentially be up to around 5 million, we hope. And that's huge because that can show a state-based response that can ward off some of these federal attacks or some of these other state-based changes. And so there's a lot of work that we can still do in other states, not just with shield laws protecting our rights, but also with substantial financial investment that actually is really not that large when it comes to the entire state budget, but can really have the profound effect of saving lives. And so just remember that there are people out there who are really fighting for you.
Well, Dallas Ducar, thank you for being my guest today on Profiles in LGBTQ plus Courage. It's been a pleasure to talk with you.
Rick, it's been such a pleasure. Thank you for the wonderful conversation.
Thank you for listening to today's interview. Founded in 1973, PFLAG is the first and largest organization for lesbian, gay, bisexual, transgender, and queer people and their parents, families, friends, and allies. We have over 400 chapters and more than 200,000 members and supporters nationwide. Our members come from every generation and live in cities, small towns, and rural areas across the United States. PFLAG is committed to creating a world where diversity is celebrated and all people are respected, valued, and affirmed. For more information about PFLAG, explore the rest of this website or visit PFLAG National at pflag.org.